Today we're talking about a kyphoplasty procedure and what kyphoplasty is used for. It can be used for spinal tumors or such as metastases or weakening of bone due to some sort of tumor. But most always, or most often, we use it for what we call fragility fractures or osteoporosis or osteoporotic fractures. That's just from weakened bone. And these fractures can happen spontaneously if someone coughs or sneezes or picks up something heavy, but often they just occur and they hurt terribly. Patients will have either mid-back thoracic pain or lower lumbar pain, low back pain. And it's quite miserable. It's worse with activity, stooping, bending. It's a little better lying down and changing positions overall. Well, these fractures in the past, before we had any surgeries for them, would get better within about a 6-month time period, and that would be taking a lot of pain pills and even bracing. But now we've progressed and we have surgeries that can help decrease the pain, if not completely resolve the pain. And that is what in general is called a kyphoplasty procedure. And kyphoplasty is basically taking a balloon or a device and putting it into the cracked bone and then making a space in that cracked bone and then putting cement in that bone. I in particular use a Kiva device, which I find in my hands works very good and is in the kyphoplasty family of surgeries. And so once we've decided that we're going to do a kyphoplasty procedure, what we do is we get you set up to see the anesthesiologist. The anesthesiologist will put you to sleep, sometimes completely under general anesthetic and sometimes just under twilight sleep. And then what we do is use x-ray to identify the fracture and say the fracture's right here. What I'm able to do is numb up the skin and literally make a 2 millimeter stab incision, just a micro incision. And then I'm able to go ahead and then place a needle into the spine bone and through this back part of the spine bone, through your backside and into the front. And when I do that, then I'm able to take a special device that coils a wire, much like this paper clip, but a stouter, better metal than the paper clip. And it coils into the cracked bone. And then over that coil, I'm able to place this plastic coil, which wraps around almost like a snake and into a cylinder. Then I remove that wire so there's no longer a wire and we just have this plastic spacer in there. And by putting the wire in the spacer, that often will take the crushed bone and jack it up to make your bone into a more normal height. And then after we put this plastic device in, then we have slots in the side here that we're able then to gently inject cement in so a cement stays within the cylinder. So the procedure itself for a 1-level fracture takes me about 20 to 25 minutes to do completely. You can go home generally that day. After surgery, you will expect some muscle aches, almost like you've been hit in the backside. So it'll feel a little bit like a bruise or some aching, but that sharp stabbing pain almost always is gone, or if it's not completely gone, will usually go away within the first 3 to 5 days. So patients often are just feeling great even right after surgery. The cement only takes really 30 minutes to cure. So as far as doing your activities after surgery, since it's minimally invasive and the cement has cured, you can actually start increasing your activities as tolerated. So we generally don't have a lot of restrictions for you after surgery. And generally after surgery, once you go home, just kind of take it easy, get over the general anesthetic, but really increase your activities as tolerated. And then you'll see me 2 weeks roughly after surgery just to make sure things look good and that you're doing okay. There are risks with the procedure. there again, there's a risk, I guess, of heart attack or stroke, blindness. These are all very rare. There's a risk of the cement going into the spinal canal or maybe into the heart and lungs. Have not seen that either, knock on wood. Risk that the other bones can crack or break because now you have a stronger cement here than your natural bone that's weak due to osteoporosis. But actually this device that I use helps protect from that happening compared to some of the other procedures done with cement. So overall, this is a very good procedure that I do probably almost a dozen a month, I would say, or getting close to that. So this is a very common procedure. Patients seem to really receive this and very thankful after this procedure. So this is a fantastic procedure for people that really need it.